Thank you very much. I'm absolutely delighted to be here today. So I am a consultant perinatal psychiatrist and have been working in this field since 1999 in London, East London and South London. And through those years, I've had the privilege of listening to lots of young women's voices and stories. And that's what I really want to centre my talk on today, is to give voice to those experiences. So just a little bit about Make Birth Better as well. We are a collective of parents and professionals. We were set up in 2018, and our aim is really to try to end birth trauma for the whole maternity system, so not just people that are there as patients, but also people that are working within systems as well. And we do that via a variety of things, through training, through campaigning, through support, and we have loads of free resources at our website, so please do feel free to have a look at those as well. Every time that I speak, and certainly as we speak, as Make Birth Better, we want to be very, very clear that we want to be a space that is inclusive for everybody, and that this is really important when we're talking about trauma, that it feels a diverse and inclusive and welcoming space for people to be listening to today. And I am going to be talking about and sharing stories, and some of these are difficult and upsetting. And obviously, I don't know everybody in the room today, and we all come here with our own stories and our own histories. So please, if you do feel that something is upsetting you, please feel free to leave. Please feel free to come and speak to me later on. Part of talking and thinking about trauma has to be that we also think about ourselves and look after ourselves as well. So I've been asked today to talk about trauma and young parents. Normally this is something that I'd like to have a day to talk to you about. So I'm going to do my very best in 20 minutes just to pick out some of the key themes and to think about those together today. So we know that from the ONS, we have good statistics about the amount of people that are classed as teenage young parents within the maternity system at any one point. So we have a good sense of how many people at any one point are in the system. Teenage young parents varies depending on what document you look at. Some people class it as under 18, some as under 19, some even up to 2021. And we know on top of that, unfortunately, as Jade was really eloquently talking about, that we know that there are lots of young people that have emotional distress, and we know from the statistics over the last couple of years that those rates have really been increasing, and particularly for young women. So we have people in the system that are young parents and also higher levels of emotional distress as well. So when we talk about young parents, I'm really reluctant to kind of clump young parents together as one group, because obviously they are not. They are a wonderful, unique mix of all kinds of different people. But we can look at sort of trends, and there's very well evidenced outcomes for younger parents in terms of not only their health in pregnancy, but also in terms of parenting and the baby's health as well. And some of these, I think, are really, really important when we're thinking about how we want to look after and support people. So particularly that sense of isolation and loneliness is very well evidenced. If we also think about the impact for people in terms of their lifetime, in terms of earnings and their ability to look for work. And then also there are certain groups that have, particular vulnerabilities. If people have been in care, for example, they are statistically more likely to be younger parents as a group. So I'm going to talk a little bit about birth trauma, and sort of touching on what Jade was talking about in terms of emotional health and how it might feel to be a young parent and be traumatized by your birth. Actually, increasingly, we really think about perinatal trauma. So we think about the fact that you could have events through your maternity journey, through your pregnancy, in labour and postnatally. It might be one event, it might be multiple events. And what that really means is that at that point you felt overwhelmed, you felt that you could not cope, that people felt hopeless or very terrified or very frightened. And that really describes somebody having a traumatic birth. The thing about birth trauma, and what is going to come through, I'm sure, today and in my talk, is about listening and hearing that person's story that's sitting with you. So trauma is subjective. If you had 10 young parents in the room today and they told you about their birth trauma, each of them would describe very different moments that felt traumatic to them. It's not about what we perceive of somebody's birth, it's about how it feels for that person. And Cheryl Beck is the classic quote that trauma is in the eye of the beholder. So it might look on paper to me or to anybody as a clinician that it was a quick vaginal birth and therefore couldn't have been traumatic for that person. But actually for the person it was traumatic because it was too quick, it felt too fast, they didn't feel cared for, they felt left alone. So it's not for us to assume what is traumatic or not for somebody. And why this is important is that we know that huge numbers of women are being affected by this every single year in the UK. Consistently across the last few years, we have lots and lots of data that shows that 25 to 40% of all women and birthing people in the UK find some part of their birth experience as traumatic. And that equates to a lot of people being affected each year. We know that that rate went up even higher, probably during COVID, probably to around 50%. And we know then if somebody has felt traumatized that they can have symptoms which last for days, which last for weeks, or which last for years. Some people will go on then to develop things like PTSD or depression or anxiety. So it's so important that we assess people and pick up on this trauma. And we haven't even really talked about people that might be coming into pregnancy as well with pre-existing childhood trauma as well. So trauma really, really matters for young people. So these are some of the women that I've worked with. So these are stories from this year or last year. So these are not stories from a long time ago. I work with people from all across the UK, and they really kind of pick up on some of the themes that I wanted to talk about and touch on today. So with the first person, I think this is a common theme that I hear with younger parents, is that they're often there with their mum or somebody else with them, and they often describe that nobody talks to them. People talk to the person with them, so they end up feeling invisible or dismissed, or that they're not in that space at all. The second is a young person that I was working with that was pregnant unexpectedly, but had a wonderful family, was really looking forward to parenting, and then had a stillbirth. And I think that last sentence, I've used this slide a million times, but it still gets to me every single time that somebody should be told that. And words and phrases like that are also often part of people's trauma. They are burned into their memory forever. They cannot forget the things that people have said to them or how it's made them feel at that moment. This of three other sort of snippets. So, you know, the assumption that being pregnant at a young age is a mistake. Sometimes it's planned, it's wanted, it's absolutely somebody's choice, so not assuming anything about people's pregnancies. Often younger parents have young partners, and I think we know that partners often feel very pushed out and sidelined. Younger fathers and partners are less likely to engage with antenatal care as a group. So really thinking about how we think about families rather than just mums as well. And the last one, again, an additional layer. So all the statistics we know from Embrace about the differences between outcomes for a white woman compared to a black woman. for example, and that, I think, really powerfully illustrates that. And again, it's something that I can't quite believe sometimes the things that are said to people, and understandably how it would feel to have that said to you and how devastating that would be. So it's often the interpersonal factors that really cause people distress. So, all the things like language, communication, how people are made to feel, whether people feel safe, whether they feel cared for, is often a cause of trauma for people. And it's particularly important, I think, with young parents to be absolutely clear that we're communicating in a way that is understood and to be clear about what we're saying to people. It can be something to do obstetrically, can be a cause of trauma, and it may be something to do with the baby as well. But often for people, it's the interpersonal things that are the hardest to reconcile. Why did somebody speak to me like that? Why did they treat me like that? Why didn't they look after me? So these things are really, really important. These are other causes of birth trauma that we commonly see. So lots of them, might be around pain control. There are obviously lots of issues around consent and, people's understanding of that and how that's being explained during a labour. And it can be systemic issues as well. So we know, for example, that if you're being looked after by somebody who's burnt out, and the care is not as good as it should be, then you get this sort of vicious circle of trauma going on for people. And it can also obviously be big systemic issues like systemic racism or discrimination can be a part of trauma as well. So just to illustrate the differences between how things can make a difference, particularly those interpersonal skills. This was a young woman that I worked with, and she really vividly talked to me about how her labour had progressed very, very quickly, and she very quickly felt like she was in more pain than she could manage and felt that her labour was progressing very fast. Consistently told this to different members of staff and was told things like she wouldn't be able to cope later if she couldn't cope now, that she needed to just cope with the pain. She was left alone for a lot of the time in her room, and she actually delivered her son herself just as the midwife was coming back into the room. So those themes, again, of, a very quick labour, it feeling very out of control, she felt very alone, and understandably, she felt really, really frightened and distressed as well. And then if we compare it with this one, this person couldn't speak highly enough of their midwife, of a true meaning of midwife, to be with the woman, somebody who made her feel completely safe and seen at every point through her labour. And also things like afterwards, she said, I'd never really dressed a baby before, let alone held one. And she helped me to do that, and she didn't make me feel stupid at any point. I felt like I could ask her anything, and she would just listen and respond to me. So that continuity, that kindness, and that last story and this story, these things will make a difference between somebody being traumatized or not. They're all the interpersonal factors. It's not often for people about what actually happened. It's about how they were held through that. So these things can make a significant difference to somebody being traumatized or not. So this comes from the Maternal Mental Health Alliance report, which came out last year, I think, if I remember that rightly, around young parents. It's a really amazing document. It makes lots of great recommendations. And they asked young parents, like, what would your dream city look like? What would you want? What would help you? And these are all the things that people came up with. So again, lots of things about openness, understanding, listening, kindness. I think really important about the role of those key people like health visitors, GPs, but also that community, those spaces, those places that you can go to and feel safe and feel heard. And we could have a whole bigger discussion about how we fund those and how we prioritise parents and how we look after families. But, those are the things that parents came up with as being the most important for them. So just want to come back to, again, listening in whatever space you are, whatever role we are, how important listening is as a sort of trauma-informed approach. really giving people space to talk and feel heard and be seen. Doctors are really bad at listening. There's lots of evidence that they interrupt after about 90 seconds on average in most consultations. That's very well evidenced. But, you know, it can be really hard not to kind of jump in or offer advice, but the power of listening to some people. And sometimes when I'm seeing people and they're telling me their story about their birth for the first time, it can take like 3 or 4 hours. And it's absolutely exhausting for them and for me, but you just sit and listen. And for them, they will often talk about that is the most healing thing that has happened for them, because they were just allowed to tell their story. And having somebody bear witness to that is so, so powerful. So these are some of the lovely comments and feedbacks that people have had. I really love the one where she talks about she didn't see my age, she just saw me. She didn't mention my age, it wasn't a factor, it was just us and her and our collaboration together. The importance of health visiting, again, and those kind of spaces in the community where people can gain their confidence, build networks, find out what's there that they can go to locally. And also friends and peers and how important that can be. Why, just again to come back to why it's so important that we're assessing trauma and we're looking after people and assessing them, is that trauma isn't just one day, one time for each person. It has a ripple effect into people's lives. So we know that it can affect potentially interactions with baby, with connection, with bonding. It can absolutely impact partners as well. There's a growing evidence around the fact that fathers can have PTSD and birth trauma as well. At the moment, most of the literature we have is around dads, but there are now groups looking at same-sex relationships and also, I think, grandparents, particularly with younger parents. It's really important to think about the impact for them as well. And we know that often after trauma, people might have issues in sexuality, they might not want to have another pregnancy, they might lose trust in healthcare professionals and not be able to go for appointments like smears or to the dentist. And it can also affect somebody's whole sense of themselves in the world and just day-to-day interactions, relationships with people around them. So it's so important that we're screening for this and have things in place to identify trauma so we prevent this ripple effect. I just wanted to mention peer support because there has been an explosion of peer support. You're very welcome to have all my slides, and we've linked loads and loads of amazing peer support resources for people. And I think peer support is absolutely invaluable, particularly for young parents. We know that for perinatal emotional health, 50% of women will never speak to a healthcare professional because the stigma is so huge. And at heart, everybody is frightened that they will be judged as a parent, that their baby might be removed. So people, you know, probably wouldn't want to come and see me as a psychiatrist because I would seem too scary and too intimidating. But people will reach out and have support from peers, and that's really, really important. And it's brilliant that there's so many spaces. They might be face-to-face, online, telephone support. So peer support is absolutely invaluable. And just to finish, really young parents, I think same really as for all parents, what I would want for them is, you know, they deserve that compassion, that kindness, that continuity, that listening to enable them to go through the whole maternity journey without having any trauma. And certainly when I was looking at writing the slides for today, it's clear that we need more research around what it means to be a young parent so that we can hopefully tailor services even more to give that kind of bespoke and holistic care to people. But more listening, more active listening, more hearing of stories, and more services and communities for all families to be able to access. Thank you.